Good afternoon, everyone. My name is Barbara Marsh, and I'm the Chief Operating Officer at OneFifteen. Unintentional drug overdoses have devastated the lives of American citizens. And in the last 10 years, over 800,000 individuals have lost their lives due to a drug overdose. In 2020, more people died of a drug overdose than any other one-year period in our history. The drug epidemic still remains a major public health emergency. One community that has been drastically impacted by the drug epidemic is Dayton, Ohio. It is where I live, where I work, and where I play. Dayton is a Midwestern city like many others. And in 2017, the national media named Dayton ground zero for the drug epidemic. Hundreds of individuals lost their lives. Families were devastated, and my strong community was brought to its knees. Our county jail was also bursting at the seams as it became the largest detox center in our area. People needed immediate treatment, not incarceration. So out of the ashes of the drug epidemic rose the idea of OneFifteen. OneFifteen was named to honor the 115 people that die each day of opioid overdoses in the United States. And this number still continues to rise. To address the gap in treatment services in Dayton, we began to ask the questions. What if we could create an ecosystem that offers a full continuum of care of services? What if we could meet people where they are? What if? OneFifteen began a quest to reverse the course of addiction treatment. In October of 2019, our outpatient clinic was opened. In February 2020, the doors of the OneFifteen Crisis Stabilization Unit opened. It was the first of its kind in Ohio. Any person who was in active addiction could immediately access treatment 24 hours a day, 7 days per week. And no one is ever turned away. People are now diverted from emergency departments, and law enforcement bring people directly to our crisis stabilization unit rather than the county jail. The crisis stabilization unit is the beginning of the OneFifteen continuum of care designed to stabilize individuals in a supportive and respectful environment. In March of 2020, OneFifteen opened its inpatient residential unit, and in June of 2021, a longer stay non-medical residential unit was added. The full continuum of care is now available on our campus, and over 4,000 people have found hope and healing at OneFifteen in just 2 years. We have a campus that looks more like a college rather than an addiction treatment center. We want our patients to feel honored and welcome. By providing a full continuum of care under one organization, OneFifteen delivers seamless transition from one level of care to the next without a break in treatment. This can absolutely be the difference between life or death for someone experiencing addiction. When the COVID-19 pandemic spread across the world, we knew we had to find a way to reach our patients virtually. The good news is, Vera Lee is a founding partner of OneFifteen, and the team of software engineers at Vera Lee developed a telehealth platform almost overnight, which allowed us to connect to our patients while stay-at-home orders were still in place. Since the platform was launched, we have provided over 10,000 telehealth visits to our patients. The telehealth platform has now been replaced with a more robust clinician platform. The clinician platform allows patients and clinicians to track progress, manage appointments, and reach out for help when they need it most. These tools are essential to our patient care. So what now? We know that criminalizations of those who experience mental illness and the disease of addiction remains a major concern in our country. In 2019, Ohio passed the Good Samaritan Law, and this law allows a person to petition the court to dismiss drug charges if a person receives a diagnostic assessment. With the support of the Sozosei Foundation, OneFifteen is harnessing technology and will embed telehealth services within our criminal justice system to support immediate access to needed assessment services. And we will continue to advocate for the decriminalization of those who experience the disease of addiction and mental illness. We have already integrated telehubs in our public defender's office, and we will also place telehubs in our courtrooms and our correctional institutions. We have placed telehubs in our hospital systems, and in 2022, we will be partnering with federally qualified health centers in rural Ohio to place telehubs in these locations. So what have we learned? We have been able to show that our patients who engage in telehealth services are more likely to remain engaged in care and less likely to drop out of treatment. We know that one size does not fit all, and that's why we believe in a high-tech, high-touch approach to care. By offering both in-person and virtual care options, patients can choose their path towards recovery. By offering a full continuum of care and a hybrid model of service delivery, we will show a decrease in hospitalizations, decrease in criminal justice involvement, decrease in overdose deaths, but we will ultimately increase the quality of life for those in my community. We refuse to allow Dayton to be defined as ground zero for the drug epidemic. While we continue to honor those who have lost their lives, we also celebrate those who have recovered from addiction and mental illness. And our community is now a community of hope, not of devastation. OneFifteen's mission is to heal people through learning, science, and partnership. So let us find ways that we can work together to reverse the course and make a difference in your community as well. Thank you.